I should say though, papillary and follicular are treated with usually with surgery, and in most cases that's all really that's needed, and regular follow-up with their doctor for thyroid replacement hormone. Um, in the traditional sense, thyroid cancer isn't treated typically with external beam radiation and chemotherapy as we would hear about, say, breast cancer or colon cancer. It's treated with radioactive iodine, or I-131. It's given to a patient in a pill form or liquid to swallow, and then they have to be in isolation from like 3 to 5 days, depending upon the dose, because you're literally radioactive at that time. Unfortunately, you don't glow in the dark, which is kind of a bummer if you have it around Halloween, but anyway, it's one of those things you want to make sure you're not around other people, so that if they have a healthy thyroid, you're not exposing them to that radiation. You definitely don't want to be around kids. So the kids off to grandma and grandpa's or with a neighbor or something like that, but you definitely need to keep that distance. Prior to the radioactive iodine, you follow a low iodine diet, so you want to starve whatever cells are remaining post-surgery, because thyroid cells take up iodine. So if you are starving them of that, you get the radioactive iodine about 2 weeks later, they're hungry. They want that iodine. So once it's administered, the thyroid cells will just suck it up and it kills them off, whether they're healthy or cancerous, regardless, it's just thyroid cells. So if that works really well, then you have a scan to determine the extent of which that's been effective. In other cases, there may be use for external beam radiation or chemotherapy, but they're not typical for papillary and follicular. They're more for medullary or anaplastic.